Canine seizures. I mean, if you've ever actually seen one, you know it's pretty alarming.
Oh, absolutely. It's frightening.
That sudden, totally uncontrollable event, your dog just transforms right in front of you. But, beyond that fear, what's really going on inside their head?
Well, think of it like a kind of electrical storm in the brain. A sudden surge of abnormal, excessive electrical activity that just disrupts normal function, usually just for a short time.
And that is exactly what we're digging into today. We've really gone deep into specialist veterinary sources, the kind of detailed clinical guides that vets themselves use, to try and give you a clearer picture of canine seizures.
Yeah, our goal in this deep dive is basically to take all that complex clinical stuff and, well, make it understandable. We want you to really get what seizures are in dogs, the many different reasons they might happen.
So many reasons.
Right. And how vets do their detective work to figure out the cause and, what managing them actually looks like day to day.
So think of this as your guide to understanding this, well, pretty common neurological issue in dogs, moving past just the scary visuals to the science underneath and the path forward.
Okay, so let's start right at the beginning. The sources define a seizure as a transient episode. It's caused by that abnormal, excessive electrical activity in the brain.
Transient meaning temporary.
Exactly. It's an event, a symptom, really.
Yeah.
It's not necessarily the core disease itself.
Okay, so it's like the brain just misfires for a bit.
That's a good way to put it. And this is different from epilepsy.
Right.
Epilepsy, the sources define that as a condition of recurrent seizures, seizures that aren't provoked by something obvious,
Yeah.
and they stem from a problem within the brain itself. The threshold they usually use for recurrent is typically having 2 or more seizures that just happen unprovoked.
Ah, okay, got it. So the seizure is the event. Epilepsy is the condition where that event keeps happening because of something actually wrong in the brain. And these are obviously significant because, like you said, they're scary, but they can also really impact a dog's life depending on why they're happening.
Absolutely. Finding that why is honestly the single most critical step when you're dealing with canine seizures.
Now, when we talk about the event itself, seizures don't all look the same, do they? The sources talk about different types.
That's right. They're broadly classified based on where they start in the brain. So you have focal seizures, sometimes called partial seizures.
Okay.
These start in a specific localized area, maybe just one side or one little part of the brain.
And what might you actually see with a focal seizure? What does that look like?
Well, the signs are often quite localized, too. The sources give examples like just one side of the face twitching, maybe an eyelid, a lip, or an ear flicking. Or you might see a head bobbing rhythmically, or even strange repetitive behaviors like snapping at the air. Fly biting, they call it.
It's lie biting.
Okay. Yeah, or chewing motions or suddenly drooling a lot. And the dog might stay totally aware during these, or their consciousness could be a bit altered. A really key point the sources make is that these focal seizures can sometimes spread
Oh.
and involve the whole brain. That's called secondary generalization.
Which leads us neatly to the other main type, generalized seizures.
Right. These involve both sides of the brain right from the get-go. And this usually means the dog loses consciousness and you see movement affecting both sides of the body.
And the one most people probably picture when they hear seizure.
That would be the grand mal, or more technically, the tonic-clonic seizure.
Yeah.
That's the classic picture.
Yeah.
The dog suddenly collapses, goes stiff. That's the tonic phase.
Right, stiffening.
Then they start paddling or jerking rhythmically with all 4 legs. That's the clonic phase. And often you'll see drooling, sometimes urination, or even defecation.
That's the one that's just really frightening to watch. How long do those usually go on for?
It's interesting. The sources say most seizures are surprisingly brief, usually less than 2 minutes. Even those dramatic grand mal ones typically only last about 1 to 3 minutes.
It feels like forever when you're watching it.
Oh, I know. It absolutely does. But yeah, typically quite short. And another interesting point is that most seizures actually tend to happen when dogs are resting or even sleeping or just waking up.
That is surprising. I might have guessed, stress or excitement would be more likely triggers.
Well, triggers can definitely play a role for some dogs. But yeah, that transition between sleep and wakefulness seems to be a vulnerable time, especially for dogs with idiopathic epilepsy. The sources also briefly mention less common generalized types, like tonic seizures, where the dog just suddenly loses all muscle tone and drops.
Like a drop attack.
Exactly. And absent seizures, which are like brief staring spells, but those are apparently very rare in dogs.
Okay, so understanding the type is important, but the sources also really stress that the whole seizure experience has different phases, and watching for these phases is super important for you, the owner.
Absolutely vital. Your observations are gold dust for the vet. The first phase is the preictal phase, sometimes called the aura.
Aura. Okay.
This is the period before the actual seizure hits. It can last just minutes or sometimes even hours.
And what might you notice that suggests a seizure could be coming?
Well, the sources describe things like the dog seeming restless, maybe more anxious than usual. They might suddenly become really clingy, seeking attention, or do the opposite, go and hide somewhere.
Mm.
You might also notice them vocalizing, like whining or barking differently, maybe drooling more or pacing back and forth. And sometimes this aura actually is a type of focal seizure itself. Maybe those subtle twitches or odd behaviors we talked about earlier.
Okay. Then comes the ictal phase. That's the main event.
Yeah, that's the seizure itself. Whether it's focal or generalized, lasting those typically short seconds to maybe a few minutes.
And then, after the shaking or the event stops.
Then you're in the postictal phase.
Yeah.
This is the period right after the seizure. And it can be really varied. It might last just minutes, but sometimes it can stretch on for hours, even days in some cases.
Wow.
Yeah. Common signs here are things like disorientation, confusion. The dog might be staggering or unsteady, pacing around aimlessly, maybe walking in circles. Some dogs even seem temporarily blind.
Blind? Really?
Yeah, it's called cortical blindness, usually temporary. You might also see them become incredibly thirsty or ravenously hungry. Polydipsia and polyphagia are the technical terms. Lethargy is common, just wiped out. But oddly, some dogs can become hyperactive or just show other temporary changes in their behavior.
And how long this lasts can tell you something.
The sources suggest the duration of this postictal phase can sometimes be proportional to how severe or how long the seizure itself was. Makes sense, really.
So, keeping track of the whole picture, what happens before, during, and after, gives the vet these really critical puzzle pieces.
Okay. Now, sometimes seizures aren't just single isolated events. The sources make a point of highlighting when things become an emergency.
Right. There are two main scenarios where you absolutely need to get veterinary help immediately. The first one is cluster seizures.
Cluster. Okay.
This means the dog has multiple seizures within a 24-hour period. The key here is that they do recover consciousness and seem somewhat normal, even if just briefly, between the seizures.
So seizure recovers a bit, then boom, another one within that day.
Exactly. But the even more critical emergency is status epilepticus, usually just called SE.
SE, right.
This is defined in two ways. Either a single seizure that just keeps going and lasts longer than 5 minutes.
5 minutes. Okay, that's the threshold.
Yes. Or it's when a dog has recurrent seizures, back to back, without fully regaining consciousness or recovering properly between them.
And status epilepticus is really dangerous. The sources are very clear. It is life-threatening. A seizure going on that long, or seizures stacking up like that without a break, can cause potentially irreversible brain damage. It can also lead to dangerous overheating hyperthermia and really mess up the body's metabolism. Stopping it fast is absolutely crucial.
So, bottom line, if you see continuous seizing or repeated seizures where the dog doesn't really come back in between, and especially if it's going on for more than 5 minutes total, that's a get to the vet right now situation.
Absolutely, don't wait.
Okay, let's shift gears to the detective work. How on earth do vets figure out why a dog is having seizures in the first place?
This is where that systematic approach we mentioned comes in, because like we said, the treatment completely depends on the cause. And the causes generally fall into two really big buckets, extracranial and intracranial.
Extracranial, meaning the problem is outside the brain, but it's causing the brain to react.
It's exactly right. These are often called reactive seizures. The brain structure itself is basically okay, but it's reacting abnormally to something happening elsewhere in the body, or maybe something the dog got into. The sources list quite a few common culprits here.
Like toxins, getting into stuff they shouldn't.
Bingo. Toxins and poisonings are a huge category. The sources specifically call out some really nasty ones, like metaldehyde, which is in some snail baits.
Oh, yeah.
Bromethylene, found in some rodent poisons. Ethylene glycol, that's antifreeze, highly toxic.
Yeah.
Certain insecticides, older types like organophosphates and carbaminase, even mycotoxins from eating moldy food or garbage.
Moldy food, wow.
Yeah. And xylitol, that artificial sweetener that's incredibly dangerous for dogs, causes their blood sugar to plummet. Lead poisoning is another one. And very commonly, dogs getting into human medications accidentally or sometimes not accidentally.
That's a scary list. What about problems inside the body? Internal issues?
Metabolic disorders are the other big part of the extracranial category. Low blood sugar, hypoglycemia is a major one. That can happen with certain tumors like an insulinoma or with severe liver disease.
Okay.
Liver failure itself can lead to something called hepatic encephalopathy, which causes neurological signs, including seizures. Same with kidney failure, causing renal encephalopathy. Severe imbalances in body salts, electrolytes like low sodium or low calcium, can trigger seizures too. And the sources also mention lack of oxygen, hypoxia, and severe heat stroke. Even strokes sometimes can fit here if they're secondary to another systemic problem like really high blood pressure.
Okay, so that's a whole lot of things originating outside the brain but affecting it. What about the other big bucket, intracranial causes?
Right, so these are the epileptic seizures that actually start within the brain itself. And here the sources break it down further into two main types: idiopathic epilepsy and structural epilepsy.
Idiopathic, that's the term vets use when they can't actually pin down a specific cause, isn't it?
Pretty much. Idiopathic epilepsy, or IE, is defined as having recurrent seizures where, after a thorough investigation, you can't find any identifiable structural problem in the brain, and you've ruled out all those extracranial causes we just talked about. So it's basically a diagnosis you arrive at by excluding everything else.
And the sources say this is actually the most common reason for recurrent seizures.
Yes, by far. It's the most frequent diagnosis for dogs that keep having seizures. It's often thought to have a genetic link, especially in certain breeds, and it typically starts when the dog is, relatively young to middle-aged. Usually somewhere between 6 months and 6 years old seems to be the common window.
Okay.
And remember how we mentioned seizures often happen when the dog is resting or sleeping or waking up? That pattern is really classic for idiopathic epilepsy.
So if you have a dog in that age range having repeated seizures and the vet checks everything else outside the brain, inside the brain physically, and finds nothing, it's likely idiopathic epilepsy. What about the other intracranial type, structural epilepsy?
Right. So structural epilepsy is when the seizures are caused by an identifiable physical problem, a lesion within the brain itself. The sources list several key examples.
Like brain tumors.
Exactly. Brain tumors or neoplasia are a common structural cause, especially in older dogs. These can be primary tumors that started in the brain, like meningiomas or gliomas, or they could be metastatic cancer that spread from somewhere else in the body.
Okay. What else?
Inflammation or infection within the brain, or its lining, things like encephalitis or meningitis. This inflammation might be immune-mediated, where the dog's own immune system is mistakenly attacking the brain.
Like GME or NME.
Precisely. Or it could be caused by an actual infection viral, like canine distemper, or fungal, bacterial, even parasitic infections can cause encephalitis.
What about injuries? Like if a dog had a bad knock to the head?
Yep. Head trauma, even if it happened years ago, can leave behind scar tissue or damage that becomes a focal point for seizures later on. Also, congenital malformations problems the dog was born with, like hydrocephalus or water on the brain, can cause structural epilepsy. Strokes that occur within the brain tissue itself, cerebrovascular disease, fit here too. And certain degenerative diseases can also be a cause, though maybe less commonly.
Man, it really is a complex puzzle. So with all these potential causes floating around, how does the vet actually go about figuring out which one it is for a specific dog?
It's definitely a step-by-step process, and it always starts with the foundation, the history you provide as the owner.
My description of what happened.
Absolutely. The sources really hammer this home. Your detailed description of the seizure events is crucial. They even strongly suggest trying to video record the seizures if you can. Safely, of course.
Because seeing it is better than hearing about it.
Often, yes. Seeing the actual event gives the vet so much information that can be hard to put into words accurately. Things like, what age did the seizures start? How often are they happening? How long do they last? What exactly did you see before, during, and after? Were there any possible triggers you noticed? Any chance of exposure to toxins? Any diet changes? Recent travel? All these details help the vet start narrowing down that long list of possibilities.
Okay, so the conversation is step one. Then comes the hands-on exam.
Right. A full physical exam checks the dog's overall health, looking for clues elsewhere in the body. But the most critical part for a seizure workup is the interictal neurological exam.
Interictal, meaning done between the seizures.
Exactly. This exam is, and this is a really key branching point. If the vet finds any abnormalities, any neurological deficits during this interictal exam, like weakness, balance problems, changes in behavior, or awareness, that strongly points towards a structural problem within the brain itself.
So if something's wrong between seizures, the problem is likely in the brain.
That's the strong suspicion, yes. Conversely, if the dog's neurological exam between seizures is completely normal, it makes causes like idiopathic epilepsy or maybe one of those metabolic issues seem more likely.
Okay, that makes sense. That's a huge diagnostic clue.
It really is. The vet might also do a fundoscopic exam looking into the back of the eye with a special lens. Sometimes changes there can give clues about systemic diseases or increased pressure inside the skull.
Then come the initial lab tests, right? Blood work, urine tests.
Yep. The sources often call this the minimum database.
Yeah.
These tests are primarily aimed at ruling out those extracranial causes. First, the metabolic and systemic problems. So they'll run a CBC, a complete blood count, which looks for signs of infection, inflammation, anemia. A serum biochemistry panel is crucial. It checks organ function, liver, kidneys, looks at blood glucose levels to rule out hypoglycemia, checks electrolytes like sodium, potassium, calcium. It might also show elevated muscle enzymes like CK, just from the exertion of the seizure itself.
Right.
Urinalysis checks kidney function again, looks for infection in the urinary tract. They'll almost always check a thyroid panel, as hypothyroidism can sometimes be linked. Bile acid tests are important for assessing liver function more deeply, especially screening for liver shunts. Blood pressure measurement is standard too. But depending on where you live, tests for tick-borne diseases might be included, as some can cause neurological signs.
So the first wave of testing is all about, can we find a problem outside the brain that explains this? If all that comes back clear, then you start looking inside the brain.
That's generally the next step, yes. And looking inside the brain properly often requires more advanced diagnostics. This usually means referral to a veterinary specialist, like a neurologist, and access to specialized equipment. The absolute gold standard for actually visualizing the brain structure is an MRI.
Magnetic resonance imaging. I've heard that mentioned a lot for brain stuff. Why is MRI so good for this?
Because it gives incredibly detailed pictures of the brain's soft tissues.
Yeah.
It's essential for actually seeing those structural problems we talked about, things like tumors, areas of inflammation or swelling, evidence of a stroke, congenital abnormalities like hydrocephalus or signs of past trauma. The sources are really clear that MRI is crucial for distinguishing between structural epilepsy, where you see a problem, and idiopathic epilepsy, where the MRI should look normal.
So MRI lets you see if there's a physical thing there causing the trouble. What other advanced tests might they do?
Cerebrospinal fluid analysis, or CSF TAC, is another really important one. CSF is the fluid that bathes the brain and spinal cord.
Right.
It's collected under general anesthesia, usually from the back of the neck or the lower back. Analyzing that fluid, looking at the protein levels, the types and number of cells, is incredibly helpful for diagnosing inflammatory or infectious conditions like meningitis or encephalitis. They might also run specific tests on blood, or CSF, for infectious diseases, like measuring antibody levels, titers, or using PCR tests to look for the organism's genetic material. EEG, which measures the brain's electrical activity directly, is mentioned in the sources, but it's used much less routinely in general vet practice compared to human medicine, though it can be useful in specific tricky cases or research. And of course, if there's a strong suspicion of a particular toxin based on the history, specific toxin screening tests might be available.
And I guess throughout this whole process, the vet also has to keep asking, was what the owner saw actually a seizure? Could it be something else?
Absolutely. That's part of the differential diagnosis process.
Yeah.
Ruling out seizure lookalikes. The sources mention things like syncope, which is fainting, usually due to a heart issue or drop in blood pressure causing temporary lack of blood flow to the brain. Certain obsessive-compulsive behaviors can sometimes look seizure-like, even specific types of head tremors that aren't actually seizures. But generally, if there are neurological problems found between the episodes, or if the seizures started very suddenly or are consistently focal, just affecting one part, that really pushes the investigation towards those structural brain causes. Whereas that classic picture, young to middle-aged dog, normal between seizures, generalized tonic-clonic events, other causes ruled out strongly points towards idiopathic epilepsy.
Wow, that is some serious detective work. Okay, so once you've hopefully got a diagnosis, or at least ruled out as much as possible, how do you actually manage the seizures?
Well, the management strategy really flows directly from that detective work. The ideal scenario is always to treat the underlying cause, if you found one, and if it's treatable.
Right.
So if you identify a cause that's fixable, like, stopping exposure to a toxin, correcting severe low blood sugar with dextrose, treating a specific infection with antibiotics or antifungals, the seizures might actually stop completely. That's the
That
best outcome.
makes sense. But what if the cause isn't fixable, like with idiopathic epilepsy or maybe a brain tumor you can't remove?
In those situations where you can't eliminate the underlying cause, the focus shifts to using anti-epileptic drugs, or AEDs, to control the seizures.
Control, meaning maybe not stop them entirely, but make them less frequent or less severe.
Exactly. While getting to zero seizures is the dream, it's often not realistic. The main goal of maintenance AED therapy is to significantly reduce the frequency, the severity, and the duration of the seizures, enough to give the dog a good quality of life. The sources often mention a common target is aiming for at least a 50% reduction in how often seizures happen.
Okay. What about those emergency situations we talked about, status epilepticus or cluster seizures? How are those handled immediately?
Right. Acute management in an emergency is all about stopping the seizure activity fast to prevent that brain damage and those other complications. The sources list first-line drugs that vets use, often given intravenously for rapid effect, things like diazepam or midazolam.
Like Valium.
Yeah, diazepam is Valium. And sometimes, vets will prescribe rectal versions of these drugs for owners to give at home if they see a cluster starting or a seizure lasting too long to try and stop it quickly.
Okay, that's good to know.
If those first-line drugs don't stop the seizure right away, the vet has other options, usually given IV as well, like levetiracetam, or giving a higher loading dose of phenobarbital to get levels up quickly. And alongside the anti-seizure drugs, critical supportive care is vital things like IV fluids to maintain hydration and blood pressure, oxygen therapy if needed, actively cooling the dog if they're overheating, and constantly monitoring their vital signs and maybe running quick blood tests.
So job one is stop the immediate crisis. Then, if there is an underlying cause that needs treating,
That gets addressed either at the same time or right after the emergency is stabilized. So that could mean giving treatments to counteract a toxin, giving IV glucose for hypoglycemia, starting specific treatments for liver or kidney disease, giving antibiotics or antifungals for infections, starting immunosuppressive drugs if it's immune-mediated brain inflammation, or even considering options like surgery or radiation therapy for certain types of brain tumors.
okay. And then for the long haul, especially with idiopathic epilepsy where there isn't a cure, you need those daily medications, the AEDs. When do vets typically decide, okay, it's time to start this dog on daily anti-seizure meds?
It's a bit of a judgment call, but the sources generally provide some guidelines. They typically recommend starting maintenance AED therapy if a dog is having recurrent seizures, and recurrent is often defined as more than one seizure within about a 6-month period.
Okay, more than 1 in 6 months.
Yeah. Or they'll definitely recommend starting medication if the dog has ever experienced cluster seizures or status epilepticus, even if it was just once. Also, if the individual seizures themselves are unusually severe or prolonged, or if there's a known structural brain disease causing the seizures, they'll usually start AEDs right away.
Makes sense. So what are the main go-to anti-epileptic drugs used for long-term management in dogs?
There are several primary options listed in the sources, and they might be used alone or sometimes in combination. Phenobarbital has been a mainstay for a long time, often used as a first-line choice.
Okay, phenobarbital.
It's generally effective, but it definitely requires careful monitoring. You need regular blood tests to check the actual drug level in the dog's system to make sure it's in the therapeutic range. And importantly, you also need to monitor liver enzymes, blood cell counts, and sometimes bile acids, because phenobarbital can potentially cause liver problems over time in some dogs. It can also cause sedation, especially initially, and less commonly, issues with blood cell production.
And side effects owners might notice.
Common ones, especially when starting or if the dose is a bit high, are sedation or drowsiness, maybe being a bit wobbly or uncoordinated ataxia, and often increased appetite, thirst, and urination, what vets call polyphagia, polydipsia, and polyuria.
So that monitoring is really key with phenobarbital because of those potential issues. What are some other options?
Potassium bromide, or KBR, is another older drug. It's often used with phenobarbital if phenobarbital alone isn't quite doing the job, or sometimes as an alternative or add-on later. It also requires blood level monitoring. One thing about KBR is that it takes a really long time, like months, to build up to a stable, effective level in the body.
Months. Wow.
Yeah, it has a very long half-life. Side effects can be similar to phenobarbital sedation, ataxia, increased appetite, thirst. Sometimes it can cause skin problems, and there's a rare risk of pancreatitis. Because it works so slowly, it's absolutely not used for treating acute emergencies like status epilepticus.
Okay. Are there newer options that maybe have fewer side effects or are easier to manage?
Yes, definitely. Levetiracetam, which many people know by the brand name Keppra, has become really popular and is often used now as a first-line drug or as an add-on.
Keppra, right.
Its big advantages are that it's generally very well tolerated. It tends to have fewer significant side effects compared to phenobarbital or KBR. It also starts working much more quickly. It's generally considered safe for dogs that might have underlying liver problems. It has fewer interactions with other drugs. And big plus, it typically doesn't require routine blood level monitoring.
Oh, that's a significant difference.
It is. Any side effects are usually pretty mild and often temporary, like maybe some mild sedation when you first start it, or perhaps a slight decrease in appetite that usually resolves. The main downside for some might be that it often needs to be given 3 times a day, though longer-acting formulations are becoming available.
Still, sounds like a good option for many.
It really is. Another one mentioned frequently is zonisamide. It can be used as a primary drug or as an add-on. Side effects can include sedation, ataxia, maybe loss of appetite. There are rare reports of liver issues, so some monitoring, particularly of liver enzymes and blood counts, might be recommended.
Okay.
And the sources briefly touch on others like gabapentin, pregabalin, topiramate, felbamide. These are often used as additional drugs, add-on therapy, when the first-line choices aren't providing enough control, rather than being the first drug someone reaches for.
So lots of options, but it sounds like finding the right drug or combination of drugs and the right dose can take some trial and error.
It definitely can.
Which brings us back to communication. With all these medications, potential side effects, the need for regular monitoring for some, that partnership between the vet and the owner seems absolutely essential.
It's paramount. The sources really stress the importance of educating owners thoroughly. That includes practical things like how to keep the dog safe during a seizure, gently guiding them away from stairs or sharp furniture, but crucially, never put your hands or anything else in the dog's mouth. They aren't going to swallow their tongue, that's a myth, and you could get badly bitten.
Good point. Important safety tip.
And keeping a detailed seizure diary or log is incredibly valuable, recording the date, the time, what the seizure looked like, focal, generalized, tonic-clonic, how long it lasted, what the dog was like before and after. This log is the primary tool you and your vet use to track how well the medication is working and decide if adjustments are needed.
Makes sense. You need that data.
Absolutely. And owners must understand how vital it is to give the medication consistently, every single dose, on schedule, exactly as prescribed, and never, ever abruptly stop giving an anti-epileptic drug without veterinary guidance. Doing that can trigger severe rebound seizures, sometimes even status epilepticus.
Wow. Okay, so consistency is key. That whole package, observation, diary, medication adherence, communication, sounds like the recipe for the best possible management. Finally, let's look ahead. What does the prognosis usually look like for dogs with seizures? What can owners realistically expect for their dog's future?
Yeah, that's the big question, isn't it? The prognosis is really highly variable. It truly depends, first and foremost, on that underlying cause that was hopefully identified during the diagnostic workup. It also depends heavily on how well the seizures respond to treatment, and honestly, on the owner's commitment to consistent long-term management.
So if the cause is something fixable, like we discussed earlier,
That scenario offers the best possible prognosis, often excellent, potentially even curative. If you find the cause, like a toxin exposure that you stop, or severe hypoglycemia you correct, or a specific brain infection you successfully treat with medication, the seizures might resolve completely and never come back.
that's the ideal outcome. Well, what about for the most common cause, idiopathic epilepsy, if it responds well to the AEDs?
For dogs with idiopathic epilepsy that respond well to medication, the prognosis for seizure control is generally considered good. Many of these dogs can achieve a satisfactory reduction in seizure frequency and severity, allowing them to maintain a really good quality of life. Some might even have long seizure-free intervals, months or even years sometimes.
That's encouraging. What if there is a structural problem found in the brain?
Then the prognosis becomes much more variable. It really hinges on what that specific structural lesion is. For instance, if it's a benign type of brain tumor, like a meningioma, that's located in a place where it can be surgically removed, the outcome can actually be quite good, with significant improvement or resolution of seizures. But if it's an aggressive malignant cancer, or if there's widespread severe inflammation that doesn't respond well to treatment, then the prognosis is unfortunately much more guarded to poor.
And when is the outlook typically the most challenging?
The prognosis tends to be most difficult for dogs
Wow.
with what's termed refractory epilepsy, That means their seizures just don't respond well, even after trying multiple different anti-epileptic drugs or combinations. Also, dogs that continue to experience recurrent cluster seizures or episodes of status epilepticus despite appropriate treatment often have a more guarded outlook. And of course, any underlying severe, progressive, untreatable brain disease carries a poor prognosis.
It really sounds like it can be a long journey for some dogs and their owners, often requiring ongoing adjustments and dedicated care.
It absolutely can be. And it's worth mentioning, the sources do acknowledge that having recurrent, poorly controlled seizures over a long period can potentially cause further progressive damage to the brain itself. This might manifest over time as subtle declines in cognitive function, or paradoxically, make the seizures even harder to control. It adds another layer of complexity to the long-term picture.
Okay, wow. We have certainly covered a huge amount of ground in this deep dive. We went from defining that sudden electrical storm in the brain to walking through the different ways seizures can look, the phases involved, understanding when it escalates to an emergency, exploring that incredibly long list of potential causes both outside and inside the brain.
Right, the detective work.
Exactly. Detailing all the detective work vets undertake to find that cause, and then discussing the really multifaceted approach to management from emergency care to long-term medication, and finally, what the future might realistically hold.
And I think the core takeaway really is just how crucial it is to understand that a seizure is a symptom. It's not the disease itself. It's a signpost pointing towards a wide range of possible underlying issues.
Yeah.
Finding the why takes that systematic approach we talked about, and your role as the owner. Your careful observation, your detailed history, your commitment to the management plan is just absolutely critical every step of the way.
Absolutely. Hopefully, digging into these clinical sources gives you, our listener, a much clearer picture and maybe empowers you a bit to understand the veterinary process if you ever, unfortunately, face this challenging situation with your own dog or perhaps know someone who is.
And it does leave us with a final thought to consider, doesn't it?
Yeah.
Given that potential for recurrent seizures, especially if poorly controlled, to possibly cause progressive changes in the brain over time, and acknowledging the real challenges sometimes in finding that perfect medication balance, the one that maximizes seizure control while minimizing those quality of life impacting side effects. Well, how much does that ongoing quest for better, safer, more effective anti-epileptic treatments really weigh on our ultimate goal, which is maintaining the best possible quality of life for these animals we love so much?
That's a really important question to reflect on. Definitely something to consider. Thanks for joining us for this deep dive.